Hello, everyone. Welcome back to MediFriend. Today, we are going to talk about a very serious but very common condition, especially in people over the age of 50. That condition is called heart failure. Now, first, I want to clear something very important. Heart failure does not mean the heart has completely stopped. Many people misunderstand this. Heart failure simply means that the heart has become too weak or too stiff to pump blood as efficiently as it should. Your heart is like a powerful pump. Every minute, it pushes oxygen-rich blood to your brain, your kidneys, your muscles, to every organ in your body. When the heart becomes weak, the body does not get enough oxygen and nutrients. As a result, you start feeling tired, weak, and short of breath. One of the biggest problems in heart failure is fluid buildup. When the heart cannot pump properly, blood starts backing up inside the body. If the left side of the heart becomes weak, fluid backs up into the lungs. This causes breathing difficulty. You may notice that you get breathless while walking, climbing stairs, or even lying flat on your bed. Some people wake up suddenly at night feeling like they cannot breathe. If the right side of the heart is affected, fluid builds up in the lower parts of the body. That is why swelling in the feet, ankles, and legs is very common. Some people notice their shoes feel tight. Others gain weight quickly within a few days because of fluid retention, not fat. Now you might ask, why does heart failure happen? In most cases, it develops slowly over many years. The most common cause is long-term high blood pressure. When blood pressure remains high for years, the heart has to work harder to push blood through the body. Over time, this extra workload weakens the heart muscle. Another major cause is blocked arteries, also known as coronary artery disease. When the heart muscle does not get enough oxygen, it becomes damaged. If someone has had a heart attack in the past, part of the heart muscle may already be permanently injured. That damaged muscle cannot pump properly, and gradually, heart failure develops. Diabetes is another important cause because high blood sugar damages blood vessels. Obesity also increases strain on the heart. Excess alcohol use can directly weaken the heart muscle. Valve problems can also force the heart to work harder than normal. The symptoms of heart failure usually appear slowly. At first, you may just feel more tired than usual. Then shortness of breath becomes more noticeable. Swelling in the legs appears. Some people develop a persistent cough, especially at night because of fluid in the lungs. You may feel your heart beating fast or irregularly. Doctors diagnose heart failure by carefully listening to your symptoms and examining your body. They check for swelling, listen to your lungs, and measure blood pressure. Blood tests can show certain markers that rise when the heart is under stress. One very important test is an echocardiogram, which is an ultrasound of the heart. It shows how well your heart is pumping blood. Now let's talk about treatment. Heart failure is usually a long-term condition, but it can be managed very well if treated properly. Lifestyle changes are extremely important. Reducing salt intake helps prevent fluid buildup. Monitoring your weight daily can help detect early fluid retention. Quitting smoking and limiting alcohol are very important. Light, regular exercise, if approved by your doctor, can strengthen the heart over time. Medications are also very important. Some medicines relax blood vessels so the heart does not have to work as hard. Others slow the heart rate and improve pumping efficiency. Diuretics, also called water pills, help remove extra fluid from the body. When taken regularly, these medicines can greatly improve symptoms and help people live longer. In more serious cases, doctors may recommend special devices like pacemakers or defibrillators to control heart rhythm. In rare and severe situations, surgery may be needed. The most important message I want to give you today is this. Heart failure does not happen suddenly. It develops slowly over many years. That means you have time to protect yourself, control your blood pressure, manage your blood sugar, maintain a healthy weight, stay physically active, eat heart-healthy foods. Get regular medical checkups, especially after age 50. Small daily habits can protect your heart for years to come. If you found this helpful, please like, share, and subscribe to MediFriend. In our next video, we can talk about early heart attack warning signs that many people ignore. Stay healthy, stay informed, and I will see you in the next video. Heart.